We use it on admission as well as quarterly, annually, and anytime there's a significant change in status with the residents.
And we embedded that, even though it wasn't a requirement, into the shift assessment to maximize, again, for that patient and for that nurse, the holistic approach to care.
And we use the tool as a way of ensuring that, as a nurse, we're covering comprehensively a head-to-toe assessment.
It's extremely easy to use. The questions are very self-directed. They help the staff to focus on exactly what needs to be answered.
HOBIC can be asked one time on admission, and then it saves several people asking the same question several times of the patient. We can collect information once.
It has helped force us, if for lack of a better word, towards standardization of nursing forms.
There are a number of reasons why standardization is important. Patient safety, communication and clarity from shift to shift between nurse to nurse and among the interprofessional team. Standardizing the assessment and the interpretation of patients' treatments allows everybody to communicate on a level that's very clear.
It is more or less pointing and focusing nursing into more of a computerized environment.
It's really good to be able to have a tablet and go to the bedside and actually do it in the privacy of their room.
And we're able to sit in the resident's own environment and actually do the assessment with them. And that's very comforting to a resident.
We take our HOBIC laptops into the rooms with the residents on admissions, quarterlies, on discharges, and we do the indicators with the residents. Residents understand what we're telling them.
HOBIC does force each care provider at the first interface with the patient on admission to actually assess that individual patient's needs from their perspective. And we actually take the time to assess it from the family's observations as well.
HOBIC looks at the resident by looking at them holistically and gives us a very good idea of what it is we need to be focusing on with that person.
So it gives you a very good sense of the patient's all-around knowledge of their own health care and what needs to be taught and their strengths and weaknesses to get them back to their optimum level of care.
Because you're answering all the questions on every system in the body, so you may find out other things that the patient didn't come in with.
HOBIC helps me to look at their functional status, their bladder continence, their symptom management, because that can have an impact certainly on falls.
So I think after you finish your HOBIC assessment, then you can speak with the doctor and say that there's more going on here.
Using the data that's actually in the computer for the current admission and the point of care allows nurse to nurse and shift to shift follow through, because one can see what's happening before and whether or not this plan is successful and continue moving forward.